And Merry Christmas Eve to you all. Thanks for tuning in. I'm Scott Mitchell, Representative Josh Cockcroft, Representative Dunnington. Glad to have you back.
Thanks, sir.
This week, the special session, it was a successful special session. It was about Healthcare Authority and DHS funding. We hadn't talked much about that before. What was the problem?
Yeah, so the problem continues to be that we're not adequately funding core services of government. And this week we've seen that again. We added 2 supplementals to get us through April to fund DHS and the Oklahoma Healthcare Authority. What really matters, though, is like an email I got this week from a constituent who was laid off from the State Department of Health because of the crisis that's going on there. Someone that's worked for the department for 11 years, a widow that will now be 63 years old with no job prospect. It's before her retirement, but just a couple of years. She's on a fixed income. I mean, these are the kind of people that have given their lives to our state and have really done everything we've asked of them. And because of our constant budget crisis, they're hurting.
All right, Representative, why was this a crisis? This is what the governor called for. Right. You, the Senate, and you guys in the House got it taken care of. But why was it a crisis this week?
Well, for one, it does go back to core services, and since 2015, we've been working with the federal government on a Medicaid waiver that hadn't been renewed since 2001, which would directly affect 2 main institutions in Oklahoma, the teaching hospitals for OU and OSU, so making sure that we're having quality health care professionals in the state when we have a situation where 64 of our 77 counties has a health care professional shortage. We wanted to make sure that we continue to be able to recruit and retain medical personnel here in the state of Oklahoma.
You know what was interesting this week? Senate, House, Governor, boom, you got it done inside of a week. Tell us what happened and why it happened so quickly.
Sure. Well, it was quickly. I don't think we've worked that quickly since the first week of regular session back in February. But, you know, we appropriated money to make sure that the Oklahoma Healthcare Authority could provide these services without provider rate cuts for our healthcare agencies across the state, as well as some additional funding for DHS. What this essentially does is it places all of our healthcare agencies on the same path, funding through April, so that we can come back and everybody's up to date until April, and we can address the situation in regular session as well.
So it was a rescue mission, and it happened in a bipartisan manner. Yes. People out there are going, wow, why can't that happen all the time?
Well, a lot got done in 1 week, and you know, for that, the state should be grateful. However, what got done in this week? We did emergency funding for 2 agencies that will get us through the month of April, meaning that they'll have to have another emergency funding to get them through to July 1st in this fiscal year. We still haven't fixed our full budget hole, and we'll need to do that as well before we get back into regular session. So while I am very pleased to see us get something done this week, I will be just as pleased if we can take that step and get that much more done the next time that we come in to finish this second special session.
Won't be long. We'll tell you about that in just a moment. All right, if the chairman was here, oh, he is here. Yeah. All right, the House probe this week, it has gotten interesting. By the way, I've listened to, thanks for streaming this.
Absolutely.
Everybody can listen to this House probe into the Health Department, but it also has involved the executive branch. What do you think that's going on? How good a job is the chairman doing in this probe, and where's this headed?
Well, I think the importance that Representative Cockcroft has brought to this probe is transparency and making sure that we know what's going on in our government. And, you know, I think like any average citizen, we all want to see that. What I find a little bit ironic is that what we're trying to accomplish in, you know, these hearings is to find out how we're spending money and why we're doing that. But we as the legislature continue to appropriate and spend money that we're not sure if we have, or we're not sure where it's being spent. So I think some of that probe should probably look at us as well and making sure that we're doing the process right the first time instead of just blaming agencies.
We could take 15 minutes on this.
Yes.
On your probe. Okay, you may be the most high-profile public official this past week. Where is your probe going? What are you trying to get done? Where could we be going in the next year?
Yeah, we've been focused since day one of the special investigation into the State Department of Health funding, as well as making sure, as Representative Dunnington said, that state dollars are being spent effectively, and that's an incredibly important step. Something we're asking a lot of the questions that we hear from our constituents on a daily basis, and we're finally in a place where we can get to the bottom of a lot of these agencies spending to make sure that we're being effective with the taxpayer dollars. Does not negate the need for funding. As Representative Dunnington mentioned, we need to continue to address that, and we will, but we're having a very in-depth look at all state agency spending, not just Department of Health. Okay, Rodney Dangerfield one time said, "How can I miss you if you won't go away?" Okay? And so when I'm looking at this, the tab you're looking at right now, which is adjourned until 1/1/18, we're using Representative Eccles' term right there. The House is adjourned, legislature is adjourned until the first day of the new year, which is a couple of weeks, by the way. So I guess the big question is, where are we going in about 2 weeks when the special session, I suppose, resumes? Sure. Well, as Representative Dunnington said, we're in a process of continuing to look for revenue so that we can effectively fund our state agencies. The funding that has gone through this fiscal year so far for these healthcare agencies only lasts till the end of April. The shortfall that was left from the overturning of the smoking cessation fee left a gap that we have continued to address in special session, the first one and the second one. And we're going to continue to do that. We're going to work together to try to find a bipartisan agreement that we can present before the legislature and hopefully have the governor sign. Representative, you have the final word.
Well, there's a lot left to do, and one of the most important things this weekend is for you to spend time with your family and your friends and enjoy this Christmas season, this time of joy. It's time for your state leaders to step up and do the right thing as 2018 approaches. And, you know, I don't speak for Representative Cockcroft, but I think that he would agree with me this morning that we're ready to do what's best for this state, and we look forward to entering the new year after this time of peace and joy at Christmas and doing what's best for the state of Oklahoma.
All right, thank you both. Have a blessed Christmas Day. Tomorrow, we'll see you again next week. See this again at news9.com/your vote counts. And Merry Christmas.